Hello. This video is about various kinds of vehicle accidents, such as cars, trucks, and motorcycles. These accidents can cause injuries varying in intensity from mild all the way to severe. Mild injuries could include cuts or bruising. Severe injuries might include brain damage, broken bones, blood loss. Excessive ongoing blood loss can cause confusion or loss of sensation. It can lead to the deterioration and breakdown of internal body systems and even death. Healing and recovery time depends on several factors: how mild or how severe the injury is, and how you care for the injury. How do vehicle accidents occur? One cause may be illegal drugs. Heroin, marijuana, or crack use may have compromised the driver. Perhaps the weather played a part: rain, snow, ice, or mud. It may cause the vehicle to swerve. Sometimes drivers fall asleep at the wheel. Excessive speed may be to blame. Drivers become distracted. There are many ways these accidents can happen. Serious injury can be incurred from any of those reasons, depending on where you're sitting in the vehicle. Whether or not a person wears a seatbelt will influence the degree of injury. A driver or a passenger can be ejected out of the car as a result of a crash. A pedestrian can be struck by a vehicle. Cars can collide with each other. All of these are possible ways injuries occur. Injuries present in many different ways. Pain, feeling sore, cuts, bleeding, and bruises are some. More severe injuries, such as broken bones or paralysis, can result from the crash. Experiencing shock is quite common, and this means that normal blood circulation in the body is slowed down, with the result that the victim becomes cold, disoriented, and faint. Breathing may become labored, or the opposite. The person may become short of breath. There may be a brain injury, which causes vomiting, confusion, or feeling dull. Diagnosis tends to be abbreviated DX, is when the doctor examines the patient and decides that you have a particular problem. At the hospital, the doctor will ask you a series of questions about your health history up to this time, as well as exactly what happened to you in the accident. Some of the things the doctor will check are your airways clear so your breathing is normal? Is your blood circulating appropriately throughout your body? Do you seem alert or sleepy, logy? The doctor will check your sensory perceptions. Are you hearing, tasting, smelling, seeing, feeling your surroundings accurately? The doctor will check your reflexes. That's when you sit at the end of the examination table and the doctor uses a small hammer to see if your legs react by kicking. The doctor will check your bones for signs of injury or breaks. Lacerations, bruising, or bleeding will be monitored. Changes in your spoken or your signed communication will be noted. Your ability to remember may be tested. The doctor may order lab work and you'll have blood drawn to be tested, and possibly x-rays too. CTs or MRI scans may be necessary to image various parts of your body. Ultrasound imaging is another possibility. All of these options are tools the doctor will use to help determine the extent of injury and what steps for recovery need to be initiated. When you get home, how do you take care of yourself? The doctor will give you a printed summary of your injuries and a list of things to do. There may be a list of things you need to get at the store, such as prescriptions for medicine and creams, Tylenol or Advil to help with your pain and bring down the swelling from your injuries. And to help relax your muscles. Also, it can help resolve infections more quickly. It's possible that instead of healing from your injuries, they can become worse. Your pain may seem to stay the same intensity, and you may feel dysregulated, not like yourself, with lingering trauma from this terrible experience. Your blood pressure may be unusually high or low compared to your regular numbers. You may have developed infections from your injuries, with cuts oozing green or yellow fluid. If your cuts were healing, they may have become contaminated with just normal particles that float in the air, and then they are slower to heal. You may not feel like doing many of the activities you were able to do before your accident, so you're less and less active. You should go back to the ER if you notice certain things occurring. If your infections are getting worse, not better. If bleeding continues and gets worse. If you have continuous vomiting. If your pain continues and pain medications aren't helping. If you're fainting, passing out frequently. Any of these would be reasons to go back to the emergency room. You obviously do not want to be involved in a car, truck, or bicycle accident. So how do you avoid it? Being safe is important. Use a safety belt. Obey the posted speed limits. Don't speed. Never drink alcohol and drive at the same time, or drive after you have had alcohol. Pay attention to the road while you're driving and avoid distractions. Don't text and drive. Avoid having long conversations while you're driving. If you have a long drive, take breaks to get out of the car and move around. If the weather's bad, be careful. If it's really bad, pull over until the worst of the storm passes. If you have to drive in bad weather, slow down, especially if there's snow or rain, ice or mud. Be careful in heavy traffic. If you're driving all night long, be careful. All of these warnings are important to keep you safe and prevent accidents.